weeks. There we go, recording. Even just within the last several weeks, there have been new changes in health guidance, especially for those in performing arts, for those engaged in mega events, and now last week's new health order on masking. So to address these and more, the Department of Arts and Culture has collaborated with our colleagues in County Public Health throughout the pandemic to share crucial information for our sector. And today, we are honored to get to hear from Dr. Emily Beeler, a liaison for the LA County Department of Public Health's COVID-19 response team. And she is going to discuss the latest guidance for arts and culture venues, as well as we're going to hear from Dr. Gilchick, who will discuss current requirements for arts in schools. Now, creating these communications and access points between the arts field and the county's public health experts has been an important part of our department's creative recovery work. Of course, we've also launched recovery grants, provided research, data, and technical assistance for the field, and created a section on our website, if you haven't seen it, that is a digital resource center to help you follow health guidance with access to information that has been vetted there by our colleagues at County Public Health and links to their website, as well as additional resources for the arts. We know the reality is that while we're taking important and hopeful steps, the pandemic is not over. And the impacts on our arts and creative sector and on our arts organizations and grantees, like so many of you, continue. So today, our goal is to help you plan, prepare, operate, and have more tools. As my colleague, Dr. Barbara Ferrer, the head of County Public Health, has said, she's praised, actually, the arts and creative sectors for your dedication, for the care you've taken and the efforts you've taken to support the health and safety of all of our creative workers, of our staff, of our artists, and our audiences alike. And so we thank you. I want to also thank our LA County Board of Supervisors and the arts deputies that support us in each of their 5 offices, our appointed arts commissioners, who some of them may be present today. And if you are, you're free to designate yourself in the chat as an appointed LA County Arts Commissioner. Thank you. And of course, our staff, as you see here, Angie Gaspar-Milanovic, our Director of Grants and Professional Development. We also have Kristen Frederick, our Director of Communications, and a whole team behind them working to ensure we could bring this to you today. I also want to thank our partners at Arts for LA and Gustavo Herrera and his team for their partnership and getting the word out for today's webinar. The arts, of course, we all know, and it's becoming increasingly known, are vital for our communities, our identity, our economy, and our well-being. So thank you for being here as we work together to reopen arts and culture safely. With that, going to get out of the way so you can hear from Dr. Beeler. And Dr. Beeler, the floor is yours to begin your presentation. Thank you.
Thank you so much, Kristen and Angie and the whole LA County Department of Arts and Culture. I apologize a little in advance. My audio is a little crackly this morning. I hope you can all hear me okay. First, to just introduce myself, I'm the liaison to the the Department of Arts and Culture. But in our liaison unit, we carve up kind of all sectors of society and talk to several. So I also talk to the music, television, and film industry, many of the large performing arts venues, some of whom I see on this call here, recognize them folks, and to the museums and to the arts in general. And one of the silver linings in this has been getting to know so many incredible people doing incredible work. And just as Kristen said, the arts really matter so much. And I think when we're hit by such a major stress like COVID, it becomes more apparent more apparent than ever how much we need the arts to get through crises, to either in some cases totally take some time out and escape from them and change the subject, or other times develop a deeper understanding of what we're living through. So thank all of you for the double challenges you've been taking on of keeping the arts going while suddenly having us on your shoulders, land on your shoulders to develop COVID expertise to somehow get through it all. It's like you're doing at least 2 jobs. My presentation is somewhat informal, in part because things are changing so fast. It is sometimes difficult to know what to prioritize, particularly today. There are announcements I just heard this morning. We think we're going to hear new information later today. So what I'm going to do is I gathered up a few very simple notes and put them into a PowerPoint that I turned into a PDF, and I'll show that to you. Then I'm going to look at we'll look at some key web pages together. And then we'll, of course, after Dr. Gilchick talks about the arts and schools, we'll have a Q&A, and probably we won't be able to get to everything in an hour, but there will be other ways to get information later. So first, I want to share my screen. So again, Dr. Gilchick and I are both from the LA County COVID-19 Liaison Call Center and in the unit. And we do have a way to contact us directly. It's not for the public, but businesses, stakeholders, nonprofits. So pretty much all the folks on the call. So sometimes it's also hard in a meeting like this to answer some very specific questions. So please do reach out to us with your issues. So right now, as we're all following, the decrease in COVID is quite dramatic, thank goodness, with cases and hospitalizations going down sharply. Over the weekend, last few days, there have been, on a few individual days, we reported over 2,000 cases in a given day, but sometimes that's a little bit of backdated reporting by some labs coming in. And I heard this morning the cases, we're pretty soon going to start reporting out cases that drop under 1,000 per day. And we don't have any new variants that on the horizon that we know of that would change the situation that much. There's the Omicron BA2 variant, also known as, some people call it the Omicron stealth variant, that is around and is a little bit different than the other variants, but we don't think it'll change the overall epidemiology and policies at this point. As we watch our decrease, we continue to gather data showing that the vaccinations continue to protect against severe disease, and to some degree, a little bit do reduce the risk of getting infected in the first place. We're also in a stage in the pandemic where we now have effective treatments available. They're not widely available, but that should change. Once they are widely available, that will also be a game changer. So policies are changing rapidly, and they're changing at every level. CDC announced a whole new structure for monitoring pandemic severity over the weekend, really announced it Friday. And as a result, the state is announcing that their laws are going to change. We always have to follow the state laws, but we in LA County are often stricter than the state, and we can be, and we often are. LA County is by far the largest county in California with over 1/4 of the population, some of the most crowded housing, and some of the largest populations of people, especially vulnerable health. So I'm going to cut first just right to the general subject of indoor masking, or rather indoor unmasking. Before I do, this a reminder that indoor masking is such a helpful step in COVID control. And as more requirements are revoked, what is also happening, they're getting revoked, so the risk is going down, but what's also happening is that some of the responsibility for deciding whether to continue indoor masking or certain other COVID policies is shifting from the government level over to the individual agency or business level. So in some ways, it becomes more difficult. Having lived through this pandemic for so long and been working 100% on COVID since the beginning and going through all the surges and the drops in COVID, it's pretty clear that in some ways the more confusing time is always when cases are going down. When cases are surging upward, at this point, we all know what we need to do, and often the laws snap into place to clarify that. But as it decreases, there really is a desire and need for businesses in individuals to do more, to engage more, and to, you know, be free to make more decisions on their own. But again, that does mean some shifting responsibility for those decisions on to all of you. And do keep in mind, you know, indoor masking is one of the simplest and most effective ways to reduce the risk of COVID. And it's a very strong thing to consider continuing, especially to keep your venue inclusive and inviting for your immunocompromised patrons. So here's just some of the key, most recent requirements that have changed. So it was on February 16th that the state of California removed their requirement for fully vaccinated to stay masked indoors. If you read the headlines, you would think they just said everyone can unmask, but what they actually did still required the unvaccinated to stay masked. So for many headlines, that very important exception or element was missing, but that's what happened on February 16th. It was just that across the state, fully vaccinated would be allowed to unmask. Many at the time also missed the fact that we kept our indoor masking policy across LA County at that time. It did not get revoked. What we announced is we would keep ours in place until our viral transmission risk dropped from high to moderate level as measured by CDC metrics. In the meantime, we did on last Friday issue new interim indoor unmasking allowance for fully vaccinated only for business that met certain criteria, which I'll go into in the next slide. So just to give you a sense of how sometimes our own cards are kind of thrown up in the air, that CDC risk level paradigm that they had been using for so long actually is got scrapped over the weekend, and they're creating a new one. So we had tied our universal indoor masking for vaccinated to their earlier paradigm, and now we have to still adjust it to their new paradigm. But the short take-home message is the state is removing their requirements faster than us. We're trying to move more cautiously, and we want the risk to get lower before we do. Just before earlier this morning, I saw that the state of California is announcing they will remove the mask requirement for unvaccinated starting tomorrow. So that just to give you a sense again of how quickly things can change, and even local governments, we in local government can sometimes get surprised by how fast things are changing, and so we still need time to adapt to that. The way all these laws work is CDC puts out guidelines, the state assesses that, decides how it applies to California, and then they put out laws and also some recommendations. And then we assess what the state has said, and we have to follow that, but we decide after how to apply it to LA County. So there's always a little bit of a delay as you go down the level from federal recommendations to state requirements and recommendations to local requirements and recommendations. So I'm sure we're going to be announcing more this week. But that said, this is what we announced on Friday. While we're waiting for the risk level, the virus transmission risk level to go lower, individual entities and venues can unmask their fully vaccinated with some requirements in place. So just taking like a small theater as an example, first the venue decides if they're going to use option 1 or option 2. Option 1 is they're going to apply this to all their customers and workers, all their patrons and workers, or just option 2, they're just going to apply it to their patrons and customers and visitors, and their workers just simply stay masked indoors. So once you've identified, are you going to apply this just to your patrons or to your patrons and your workers? You choose, you have to verify in that group, your chosen group, whether everyone is fully vaccinated or not. And if they are not recently vaccinated, they have to present a negative test. For your special event, if it's a patron, they have to have a PCR test from within 2 days. or if they're using an antigen test, it has to be within 1 day. If you're deciding to apply this policy to your workers to allow your unvaccinated workers to unmask at work indoors, then your unvaccinated workers have to get tested every 3 days. I'll stop for a minute here and say, basically the thinking is, there are some venues that already do this. It's mostly mega event venues, or many venues in LA City that have been verifying vaccination status. So the idea is, if you're already doing these verifications, you can unmask the fully vaccinated people in that group. It does create a little bit of an issue if you're trying to set this up for the first time, because essentially your unvaccinated people have to keep getting tested and have a negative test. I have a program of that to allow just your fully vaccinated to unmask indoors. So that can seem a little awkward, but if you already have this policy in place and you're doing it steadily to everyone in the group, either testing or vaccine proof, then the vaccinated can unmask. By the way, a question that comes up is, do these fully vaccinated people have to be boosted? And the answer is no. The policy is just the initial primary series has to be finished. If you're going to start having certain fully vaccinated folks unmask inside, all the workers have to have a respirator type mask. In practice, for most people, most businesses, that means a KN95 or maybe a KF94, not just a surgical mask. So it's sort of upgrading to the better masks. And again, the unvaccinated or partially vaccinated have to continue to mask if you're using this exception. There are many other masking requirements at the federal and state level. Some of the most important to remember are public transit, either inside the vehicle, like the airplane or the bus or the subway, or the hub, so like the train station, the airport, et cetera, and healthcare settings. So you're going to see your doctor, you have to mask up no matter what our local laws or state laws say about masking. Also applies to correctional facilities, homeless shelters, et cetera. It has also applied to schools because at the state level, but that's changing, and Dr. Gilchik can talk more about that. And I'm hoping to not give you motion sickness here. So we have one of the links I sent you is this one down here. It's our best practices for smaller events and cultural venues is the name of the link. This is how the URL reads out. And there's a really helpful table on that webpage. We try to make it as useful as possible. And this, for the events that are smaller than mega events, we tried to make this be almost your one-stop shopping page. So I grabbed that table. I did change it a little bit to try to include some of the new information and consolidate some info. But if we were talking about an indoor venue with under 1,000 patrons, so it's not a mega event, the masking rules indoors it's essentially required, again, this is an indoor venue, required for all patrons and employees, and that we also have had an employee mask upgrade in general to include KN95s, KF94s, or surgical masks. And then there's the new interim unmasking from last Friday that I just walked you through. And there is another page that goes to that. So in this indoor venue that's not a mega event, do patrons need to show proof of full vaccination or recent negative test? Well, if you're in LA City, it has been required for everyone 12 and older. But if you're not in LA City, it's been strongly recommended, but not required. Generally, when we recommend it, we recommend you follow the mega event requirement, which is that people show proof they are either fully vaccinated or have a recent negative test. And the terminology, the timeline for those tests is here. These are standards that the state created for mega events. The update for mega events, I think about a month ago or so during the Omicron surge. And so it's PCR test from within 2 days or antigen within 1 day. So that's what we suggested. So for performer requirements, our recommendation not a requirement anymore is for performers to be at least 12 feet from audience members. And related to performer unmasking, for a little while, this has been our requirement that if the performer is up to date on vaccination, meaning they're boosted or they're not yet due for the booster, but they got the initial series, that they're tested at least minimum 1 time weekly. If they're not up to date or they're unvaccinated, to test at least twice weekly. Now that we have masking rules changing in a bigger sense, that will undoubtedly change, but at least at the moment, that's how we have it put. I'm just going to pause to make a real pitch for ventilation. In addition to, as the requirements start to go downward, in addition to strongly encourage everyone thinking about continuing with the simplicity of indoor masking for all, for both inclusiveness of the immunocompromised, procedural simplicity, and just our overall safety. The other really key thing is ventilation. Sometimes we don't talk about it enough. I've certainly learned a lot about ventilation throughout the pandemic that I didn't know before. And the addressing your indoor ventilation is really, well, let me back up and just say, we know that the risk of catching COVID is dramatically lower outdoors than indoors. And the whole point of good ventilation is to try to make the indoor seem more like the outdoors in terms of airflow. So it's really key to reducing risk. You want to use maximal outside air as much as possible. If it's safe and secure to open doors or windows, and you always may have other considerations that are quite valid for keeping a door or window closed, such as personal safety, but if it's safe to keep them open, that can be incredibly helpful. It's good to learn more about your building's HVAC system if you haven't already done it, and try to find out how many air changes per hour you're creating or have in your setting. How can you change it? The recommendation from the state is to aim for 2 to 6 air changes per hour, using more if the space is crowded or you have fewer doors and windows open. Set, if at all possible, your HVAC system 100% outside air. It is less energy efficient to do that. You're not recycling air, so you have to heat or cool more of the air, but that does improve COVID safety. You run it for before and after the event. One criteria has been 2 hours. I'm not sure it really needs to be that long, but getting it up and going beforehand and then running it after. There's really a lot that can be useful about learning about use of fans. And sorry, I partly blocked my own text there. If you're relying on fans with open doors and windows, and you have just one fan, it's when in doubt, just set up one blowing outward outside of your space. That's a little counterintuitive, but you're basically want to use that fan to extract infected air that may be in your space. And on the opposite side of that space, if you have doors or windows open, it'll be gently pulling it across, creating air movement that is not too strong. The state, one of the, I'm not sure if it's one of the links I sent, and if not, we should add this. The state has kind of a somewhat long guidance on ventilation, but I hope you find it's very thorough, and I think it's pretty readable, and it's worth reading. They do talk about use of fans there as well. And then also we have, just as an example, particularly if you're doing a school performance in a gymnasium, you may review our gymnasium ventilation document. One of our physicians investigating basketball team outbreaks did some ventilation studies and found that ground level ventilation, even in some new gymnasiums, was not very good because the HVAC systems are so high in the room. So some strategic placement of fans and use of open doors can help tremendously. So everyone is thinking about the future. One of the questions we had is, when will it be safer, large, fully vaccinated, boosted indoor choir to sing without masks? Unfortunately, the answer is not completely clear. It's certainly much safer right now than it was a month ago. And again, as we revoke more requirements or switch more requirements to recommendations, we ask you more and more to perform your own risk assessment. In addition to continuing to follow the news and our reports about the risk level of COVID, about the amount of virus transmission and case or severity, think about the higher risk individuals that are either in your patrons or perhaps in your workforce. How much can you increase ventilation? If you really can't increase ventilation a lot, then maybe you want to be the one who relies more on indoor masking or vaccine and test verifications. And can you test everyone before performers, particularly your performers? If you can, then you can you get more safety, of course, from that measure. And so, to what degree do you want to discuss this as a group to get buy-in, particularly from your patrons? Maybe you want to survey your patrons. I think that can be really helpful. So I sent you these links. I will add these additional links. I'll send them on to you, Angie. The state does maintain a list of laboratory services for venues that, sorry for the typo, that do want to provide perhaps on-site testing. They, some of them offer full service testing that they'll send someone to actually do the sampling. The cost seems to vary wildly throughout the pandemic, but the state keeps that list. There's also a reference about free and low-cost personal protective equipment. The LA County Department of Consumer and Business Affairs has this webpage here for nonprofits and businesses for various resources to help. And the school-based COVID team did tell me, one member that works with Dr. Gilchick, that just happened to mention, and I put it on this list, that because there are stockpiles, or at least some supplies, I shouldn't say stockpiles, it makes it sound bigger than it is. There's some supplies of free tests that have gone to schools. In some cases, some free tests may be available to arts education programs. Okay, I'll just show you really quick. As of Thursday, this was the risk assessment measurements that CDC was using, and we are in high, and we were going to drop indoor masking for vaccinated once we reach moderate. And then on Friday, they announced this. So a whole new change. And I'm personally just reading more about it. It's kind of nice that it does focus more on hospitalizations, so sort of the severity impact. But at least as of right now, we're still in the highest level, according to CDC. Okay, quick time check. I will just go really quick some of the web pages. And if I still have time, how are we doing on time, actually, Angie?
If we could move on to Dr. Gilchick's presentation, so that we can get to question and answer, that would be fantastic.
Perfect.
And I don't mean to cut you off at all.
Oh, no. It's, we could have a whole day talking about this. So that's one reason it's a little hard to pick and choose. So, all right. Thank you very much. I'm definitely happy to answer plenty of questions. And I'll show the web pages as part of my answer if needed.
Awesome. Thank you, Dr. Beeler. And again, just repeating that we will be sharing everything, this PDF that she's compiled with everyone following this session. So with that, Dr. Gilchick, welcome and thank you so much for being here.
Oh, it's my pleasure. Thank you for having me. Do a quick introduction. Yes, I'm honored to be one of Dr. Beeler's colleagues at Department of Public Health. My position is I am the section chief for child and adolescent health in the department. And since we began this pandemic response and state of emergency in Los Angeles County back in March of 2020, actually, I started working on COVID a couple of months before then. But ever since that period, I've been sort of the primary liaison to the education sector, sort of all levels of education, childcare, K-12, and higher education. So I don't have slides, but what I'm going to do in just a few minutes is just run through the sort of special unique guidance we have for performing arts in K-12 schools and in higher education. So, and if you wonder what higher education is, we define it quite broadly. So it's anything post-secondary we would consider higher education. So that's four-year colleges and universities, community colleges, technical schools, schools that are devoted strictly to performing arts. If it's post-secondary, it would be higher education, trade schools, vocational schools, professional schools, et cetera. So, but to start off with K to 12, right? Elementary, middle, and high schools. What's interesting and different, of course, about the performance venues or performances that Dr. Beeler talked about is that school settings, youth settings are currently governed by some specific mandates from the state, which we've reproduced here locally, which is that indoors at this time, masking is always required in an indoor setting for staff, for students. So clearly that obviously impacts many aspects of performing arts. Actually, until recently, during the surge, we, the county, were also requiring use of masks in outdoor settings, in schools, in K to 12 schools, and in childcare. We lifted that mandate when we decided we had met the threshold for being post-surge. So at that point, masking outdoors became a strong recommendation if you are in a crowded outdoor setting or an outdoor setting where it's difficult or not feasible to create any distance between yourself and other people. We then recommend masking outdoors, but it's not required at this point in any setting in LA County. Indoors, of course, is still required in the school setting, the K to 12 setting, anytime indoors. So how do we manage certain aspects of performing arts? It comes up most notably in regards to music, not only music, but most of the questions we receive are about musical performances, both instrumental and singing. So for instrumental, we're dealing with wind instruments and how does one practice, play, perform with wind instruments if they have to wear masks indoors? How does one, practice or learn or perform as a singer if they have to always wear masks indoors? So again, in some degree, we are dictated to by state. The state has some guidance and some rules around this. So of course, we have to match what the state is doing. So first, of course, we always say, if you can do it outside, do it outside, right? Not only is it simply safer due to ventilation, right? You don't really have a need for ventilation assistance outdoors, as opposed to indoors, where droplets or aerosols can sort of build up in an indoor environment over time, right? Outdoors, it just disperses, continually disperses, because you've got an infinite amount of ventilation or air exchange, right? So if you can do it outdoors, do it outdoors. Not only is it much safer in terms of ventilation, but you're also not required to wear masks outdoors. So you can have your full instrumental band or orchestra playing outdoors. You can have, a group of singers, a choral group or whatever, singing outdoors. If you can't, and what we would hope is that one would, the group or the instructor or the supervisor who's working with youth would try to put some distance between those who are, singing together, especially if they're not wearing masks, or those who are, playing wind instruments. Now, what happens if it is indoors? Well, we do have some allowances for playing wind instruments indoors. Again, matching up with what the state has recommended. One, if you're playing a wind instrument, we require indoors that they wear a special face covering or a modified face covering that covers, still covers the mouth and nose, but does have a slit opening where one can pass the mouthpiece through. There, you don't have a perfect seal, but you still have a pretty good seal over the nose and mouth. Secondly, if it's possible to fit a bell cover or filter over the end of the instrument or the open part of the instrument, that's required to do so. There is a minimal physical distance that's required between people who are playing wind instruments and anyone else in the ensemble, and it's 3 feet is the minimum distance. The more distance possible, the better. But we know that there is a finite amount of space on a stage or in a practice room. So 3 feet is the minimum, though. And then last but not least, we do require a weekly screening test for COVID-19 to be done by all individuals in the group who are not fully vaccinated and are participating in the group or practice or performance. So those who are fully vaccinated are not required to do the weekly test. It's recommended, but it's not required. Now, as I said, if there's a group playing outdoors and there's wind instruments included outdoors, all of those same safety mitigation factors or preventive measures are recommended, but they're not required. We just what we ask is to create some physical distance between the players. If one wants to use modified masks, bell covers, etc., that's great. It is not required. Okay. So let me move on, try to do this quick. Obviously, there's some other modalities, right? Some other arts and performance modalities besides simply I should say singing. There isn't really an option indoors right now today, because the mouth is the instrument, the voice is the instrument, and masks have to be used indoors. So at this point, in a K-12 school or a supervised school group or school activity setting, singers do have to sing with masks on, whether they're practicing, whether they're receiving instruction, whether they're performing. If they're indoors, if they're outdoors, there's an option, right? Masks recommended, but not required outdoors. For other performing arts, including theater classes and dramatic classes, dance classes, at this point, again, outdoors, masks recommended, not required. Indoors, masking is required. If one is exerting themselves significantly, say during a dance rehearsal or practice, one certainly is encouraged or entitled to take a break as needed, get some water, move far away from others, remove the mask for a short period, but they are supposed to wear the mask technically, at all times when practicing, performing, etc. Let me move over quickly to higher education, which looks a little different. We had a meeting early on in the fall semester with a number of institutions and some directors of musical departments or performing arts departments, and talked about this. And a very strong case was made that at least at that level, of post-secondary training, especially graduate level training, we're dealing with, students who really are training for professional level performance careers, and that to, again, have to sing or perform on stage, with theatrically, always with masks on, was not very practical. And we basically took that to heart and we accepted that. So we do give some more freedom for higher education to perform without masks on. So for indoor performances, again, outdoor masking optional, indoor we're more cautious. So let me talk about indoor, because I think the outdoor, you got it. I think we got it covered for outdoor. For indoor, now all non-performers, as we know, who are in attendance, audiences, need to wear masks at this time. That's changing, right? But for today, at least, everyone indoors has to wear masks. But the performers, the student performers who cannot feasibly do their performance while wearing a mask, and you could say that's true, obviously, for people who were singing, for people who are doing perhaps dramatic performances, and seeing their faces particularly important. Maybe for people who are exerting themselves in a dance performance, etc. I think one could easily make the argument it's not very feasible or practical for those performers to wear masks, just as in our professional performances, there are exceptions being made. So for students in higher education, as long as all the performers and the stage crew, basically everyone working in proximity with each other during the production, as long as they all test twice a week, starting at least 72 hours before the ensemble begins working together, as long as they continue to test, at least 72 hours before and then twice a week until the end of the production schedule, they can perform without masks. And obviously, if anyone tested positive, they would, go through the usual isolation and contact tracing, quarantine procedures. I think for the interest of time, I'm going to stop there because I know we wanted to leave time for questions and answers, and I'm sure there will be some. I really have covered most of the material, but if one wants to look this up in more detail, Dr. Beeler has included the appropriate web links, and basically it's the guidance for institutes of higher education, and it's the protocol appendix T1 for K-12 schools. That's really where I'm getting all this material from. So let me stop there and sort of open up the mics.
Thank you so much, Dr. Gilchick. I know I can see that there are a lot of questions in the chat. So what we'd like to do is just spend a moment or two with some of the questions that are school related. And then we'll move into some of these for performing arts more generally, in terms of a few categories that we saw when we reviewed the questions that as they were coming in. So, and thanks, Kristen, for popping links into the chat. So one of the questions that I'm seeing is, what about performers coming into schools for assemblies? This is from Dana Leach from Musical Theater West, and I'm assuming this is in terms of masking, if you could speak to that.
So you're talking about outside groups coming in to perform?
Correct.
Okay. Well, yeah, actually, that's a great question. And I do have a pretty straightforward answer. At this time, and I didn't really talk about what's coming, I should speak for a minute about that. But at this time, anyone, child or adult, who's coming into the school as a visitor, as a contractor, as a performer, does have to follow the same masking guidance. So everyone inside a school setting has to wear a mask. So I guess the best case scenario would be if one were scheduling an external performer coming in, it would really behoove them to do it outdoors, where they'd have the option to remove the mask. But the one announcement Dr. Beeler didn't mention, I think she left that for me, she didn't want to steal my thunder, is that the other announcement that came from the governor today is that in-school masking as a mandate would end on March 11th, basically the close of day on March 11th. So as of March 12th at the state level, masking indoors for students and staff will be strongly recommended, but not required. And Los Angeles County has already released a short statement, press statement, saying that we will align with the state. So that means as of March 12th, beginning March 12th, masking indoors at school will no longer be a requirement. It will be strongly recommended. So, the school, clearly schools and school districts have a lot of discretion as to how, loose or strict they would like to be. So the same question, if you ask me the same question on March 12th, which is my mom's birthday, the answer would be the performers coming in may be able to perform without masks on. The county would permit it, would not prohibit, them coming in without masks. It would be up to the school whether or not to allow it.
Thank you, Dr. Gilchick. There was another question and you just answered it, of what happens come March 12th. I think, I just want to remind everyone that there are the links to direct information. We've also shared a hotline where you can ask Department Public Health liaisons your specific questions. And I'm going to move into the indoor performances as a category. If you have questions, go ahead and put them in the chat. We'll spend a few minutes on that. And then if there are questions regarding vaccination check protocols or staff training, I think we'll have time to answer some of those questions. So please feel free to ask your questions regarding indoor performances not related to schools or universities at this time, but at performing arts venues.
And Angie, real quick, while you're looking for a relevant question, I just want to highlight, in case it slipped by folks, that there is in the links that we have and that will be shared out with everyone via email after this. County Public Health does have a toolkit for vaccination checks that goes into detail. So if your organization feels that you'd like to have additional support or review how you're doing it compared to what they might recommend, that is one of the links, because I know that that's one of the topics. Thanks.
Great, thanks, Kristen. And also Cheryl from Boston Court lifted up, and I think I just want to acknowledge everything that the frontline staff have had to, with changing protocols. They're the ones that are seeing your patrons first and having to answer questions, having to check vaccination status, and just recognizing the stress of that position at all of our organizations. It's a real challenge. Let me see here. There's a question. How do we advertise the masking requirements for our indoor concert in a few weeks?
That's a really good question. I would turn back to thinking about whether, I think the easiest thing organizationally is to stick to what's allowed today and to communicate that soon and tell your patrons things are changing quickly. We don't know, what's allowed may be different by the time our event happens in 2 weeks, and say, but this is what we're going with. Moreover, you might decide you're going to remain more strict than what's allowed right now, or COVID cautious. I think a lot of venues should talk a lot about whether they want to remain more COVID cautious than what's allowed to consideration of their immunocompromised. But the messaging is so important. As soon as people see headlines saying unmask this or that, or the governor says this, there are certainly many people who automatically assume the headline version of it applies to them no matter where they are. And so the capacity for people to misunderstand what's allowed is very large. So repeated and heavy messaging on what your policies are, I think is really important ahead of time. You probably have to message like twice as much as you usually do at this point because it's changing so fast.
Thanks, Dr. Beeler. Another question I'm seeing is for single day live music performances, is testing a requirement or a recommendation for all performers? That was unclear.
That's a really good question. If it's a single time performance indoors, yes, the performers really do still need to be tested. So if they're up to date on their vaccine, they should be tested once. Actually, for both of them, they should be tested once. What PCR testing is more sensitive than antigen testing. For some venues, what we have, many of them are pursuing is for a single time performance, particularly if they have several people, they will test unvaccinated people or people who are not boosted twice, like 2 to 3 days apart. And they will test the fully vaccinated booster just once before having to come into unmasked. So that's one way it's sort of been more interpreted for one-time performances, is still doing the one test and the two tests, but just moving them up closer to the time and using the timing of the test, using the mega event patron testing requirement as a guideline. So certainly relying on antigen tests for a performer, it's best if it's within 1 day, or if you're relying on a PCR test, best within 2 days. And if you have an unvaccinated performer, it's best to do both. But these are interpretations of what the requirements have been. And these original requirements were set at the state level, saying once and twice a week, so we've been sort of interpreting them that way when they first released mega event requirements quite a while ago.
Thank you. I'm seeing another question about church choir and congregational singing requirements. Or is this up to the archdioceses or the parishes?
You know, I'm not entirely sure. We have had a liaison just for faith-based organizations. There have been so many particular issues related to, very eventful developments and just a lot of discussion around sector, particularly early last year. I just say, you know, no matter what setting you're in, whether it's a faith-based organization or a cultural venue, the risk of transmission is highest indoors. So we would recommend that masking still be used. But I'm not sure in terms of requirements. I know that there were some special factors for faith-based settings, and we have had a number of telebriefings for faith-based settings, and you can email our liaison unit to ask to be added to those listservs if you're a faith-based organization.
Thank you. I know it's 2:59. This hour flew by. There is just so much information and ground to cover. Is there anything else you'd like to share about what's coming in the next months? One of the questions we saw that kept coming up was like, I'm trying to plan for May, June, July. You know, there are some changes now coming up in the next few weeks. I know you don't have crystal balls, but is there anything else that you'd like to share with us before we close out?
I say, given the uncertainty, the more you can plan in terms of the principles we've been talking about. If you can have it outside, do it outside. If you can, you know, reserve that outdoor setting now in advance, that's your number one. If you can possibly do it outside, you will, but just by definition, make it a more resilient event. Resilient to whatever policies may show up or vanish. And if it has to be indoors, then put that time into maximizing the ventilation, and consider asking your patrons to say, hey, no matter what, think of this, be COVID cautious. And the number one element would be, right now we're planning to ask you to wear your masks. You can always put those policies in place now, safety policies in place, and potentially revoke some of them closer to the event and simplify it a little more if needed, but better to plan them in now.
Great, thank you. And Dr. Gilchick?
Yeah, my crystal ball says it's going to be a lovely spring and a beautiful summer. And if you and the people you care about, those around you, are all fully vaccinated and boosted, it's going to be a stupendous summer. So that's my forecast.
Thank you so much, Dr. Gilchick, and to you as well, Dr. Beeler, and to our director, Kristen Sakota. Thank you all for being here today. We will be sending you about 1 million links, a recording, an FAQ, and a phone number that is not a public number, where you can either call and email to get some of those specific questions answered, especially with how much everything is changing at a rapid clip. And we know it's a challenge to plan in advance when there are some unknowns, but I'm going to take Dr. Gilchick's words to heart and end on a hopeful note. If we're doing everything we can to keep our patrons safe, as well as all of you staff and performers at arts and culture organizations. So thank you everyone for being here today, and you will be hearing from us with a mega email. Thank you.
Thank you, everyone.
Thank you.
Thank you, Dr. White Clayton. Thank you for being here.